Good morning. Good morning, everyone. And good morning, our dear second day of the Health Data Forum Global Hybrid Summit, now in a truly hybrid format. We apologize, day one we couldn't be with you. Today we are able to do so. And it's a pleasure for me to be here. I'm Paul Nunes-Dia, the fire starter of Health Data Forum. And it's with great pleasure that I'm now introducing the opening speaker for today, Professor Rhidian, Hurle, and Matt Wintle. They are going to, both of them, I suppose, are going to introduce us a little bit on a recap of last day and setting the background for today's session, where we're going to have a keynote speaker, Dr. Emma Gordon, who is already here, and Tiago Taveira Gomes, which unfortunately cannot join us in person. He was here yesterday, but he will be online delivering his keynote. So enjoy the day.
Morning, everyone in the room and online. My name is Rhidian Hurle. I'm the Medical Director at Digital Healthcare Wales. It's a pleasure to be here on a sunny day in Cardiff. The Four Nations Plus group, digital leaders across NHS Scotland, Wales, England, Northern Ireland, and indeed the Republic of Ireland, met yesterday. And so I wasn't here, unfortunately, in the afternoon to see the event, but my colleague Matt was, and I've given him the task of summing up yesterday.
Thank you, Rhidian. Morning all, and it's a real pleasure to be here at this Health Data Summit, which truly has global reach. Welcome to everyone online. Bore daw pawb is what we say in Welsh. So my job is to sum up the day yesterday, which I thought was absolutely fantastic. We had some wonderful themes throughout the day. I've only got a few minutes to sum it up, so I'll try to encapsulate the day rather than go through each lecture. One of the themes in the day was why Wales, and kicked off very nicely with what's going on in Wales from Helen Thomas, the CEO of Digital Healthcare Wales, which was quickly followed by Michael West, reminding us on the importance of compassionate leadership and the evidence basis for compassionate leadership, which I thought was quite remarkable. Most of us in our jobs want to handle our workload. We want a sense of belonging, to work in teams, and we want to contribute, and for that contribution to be recognised through learning and development. And if there's one thing about health data and digital work, it is the teamwork. It's a socio-technical journey, and I thought that was a very sort of anchoring moment for the day, reminding us that this isn't all about data and pipelines and digital. This is actually very much a people process. Moving on from that, Ethan Evans reminded us of what our common goal is in global health data, and that is to improve the health outcomes of our people and our populations. And how do we get there? We get there through actions, and actions require decisions. But before you can make a decision, you need the information. And you need all the information, not some of the information. And data alone, parts of data alone, is not enough. So all the information needs to be collected in one place, and obviously our systems are designed to actually collect all the data in one place, and we need to look at interoperability of those systems and the standards that we use to actually speak a common language. And I thought there was some nice analogies from Ethan around how 8 languages between different families need to be translated in multiple ways, but actually our systems, our interoperable systems, need to be able to speak the common language. Then we've sort of touched on the use of data and the importance of patients in informing us of what is appropriate use of data. The 4 principles of use of data, obviously for direct care in healthcare, to actually build a more intelligent health system, so to understand our supply and demand and be able to target maybe how we can get ahead of that, and we'll focus more on prevention. We all have health systems, but I'm afraid health systems are largely disease systems where we treat disease. We don't really have a prevention-focused health system where we actually look to improve health and maintain health of populations. And that was picked up later in the day when we started talking about the social data. And as we all know, the social determinants of health are approximately 60 to 70% of the determinants of health. And so it's the importance of thinking about health data as well as social data is very important in terms of improving the health of populations. The other two components, if you like, of the use of data is value, and a lot of value lies in prevention. And so those two things are inextricably linked. And then the fourth component of the use of data is research and innovation. And how do we foster an environment where we leverage new technologies to improve health? There are a number of new technologies coming down the pipeline, such as genomics and artificial intelligence, and how we actually build our system, our governance frameworks to incorporate these and to actually introduce these into the health system is a challenge for all of us. It's a common challenge, but it's also a fantastic opportunity. The UK Four Nations panel that Rhidian referred to yesterday was an excellent insight into where we are across the UK at the moment. In the UK, we're sort of building the docking station in the public sector, the docking station to enable collaboration with the private sector, both the life sciences sector as well as the technology sector, but also the third sector. And the third sector can help us bring patients into the centre of that. And through that collaboration, 3 ways, we can actually build a process that can not only foster innovation, but also help us design a better health system. That reimagining of health system is really important, and maybe that's something that we're not currently focused on. Maybe we're so focused at the moment on actually digitizing the current process rather than actually reimagining how technology might actually help us create a different future. That's something we're all committed to moving to. AI is a common opportunity for all of us and a challenge. The governance frameworks for AI across 4 nations are being put in place rather than currently existing, and technology companies are exciting both the public, ministers and healthcare professionals about the potential of AI. Unfortunately, the governance structure side of it also needs considerable consideration. There is a standard innovation process, if you like, for the evaluation of the risks, the benefits and the value of AI, which is an important thing for us to bring all stakeholders along with us and to help educate decision makers, whether they be patients, healthcare professionals or more senior leaders. We have the same issues across the 4 nations. And because we have the same issues, greater collaboration across the 4 nations and across perhaps globally would be helpful. If people are hearing a similar feedback from the experts on the ground who are actually doing the work, I think that would be a very good step forward, if you like, on considering how we actually deal with some of the opportunities ahead. We had a nice reminder of the importance of or the potential of precision medicine, particularly in rare diseases and cancer, where these are global considerations, and therefore the federation of data and actually the contribution of data globally from citizens around the world can help to accelerate our ability to actually leverage technologies and deliver precision medicine around the world. That requires considerable technological interoperability on the background, and we were reminded of the infrastructure that's needed, both on the governance side of data as well as on the technical side, to actually act locally but think globally. Trust and transparency was a major theme throughout the day, and we have each country around the world has its own with local citizens is very important, and then that transparency globally, where data goes and what it's being used for, also was mentioned as being very important. And if we're going to realise the benefits of innovation, we need to think globally and act locally. In the afternoon, we had a wonderful talk, I thought, by Steve McFeely, who was the Chief Statistician Officer for OECD and previously at WHO. And he reminded us of how science and the scientific process is essential, if you like, to understanding data. Science is the process of going from uncertainty to increased certainty, but almost never certainty. And it's that process of actually trying to get more and more certain about what the data is showing you. And it's not the data that should make the decisions. It's always the decision maker, informed by the data, that should make the decisions. When we move into algorithmic decision making, we are removing the decision maker often from the process, and we have to be very careful about the human impact of that. And I thought that was a very poignant and important message for us from the chief statistician from OECD. Just checking on some notes here, because it was a long day. So digital governance came up quite importantly. Who gets to decide? What say does the individual patients have, individual citizens have in the governance of their data? And I think that's a very important aspect. And then the laws, there's law, and you can comply with the law, but then above and beyond that, there's the ethics. And we had a nice presentation from the information governance experts in Wales about the Welsh Accord for the management of personal information. And they reminded us that collaboration between the ICO, which is the regulator for information governance in Wales, along with the ethical side and use of data, was very important, and that helps us, if you like, demonstrate our use of data back to the public and maintain that trust. As we all know, once you lose trust, it's very difficult to regain it. So we must take these steps carefully and actually ensure that the citizens are with us in how we use data. We had a nice conversation about what we learned about the pandemic and how do we build on our lessons there. One of the key themes for me throughout the day is this digital infrastructure that we're building for health is clearly a national critical infrastructure. We don't often think of things put that firmly on our plates, and maybe we've gone back to normal rather than actually accelerated our vision to actually build that national critical infrastructure, which importance of health data and its potential impact across infectious diseases as well as chronic diseases in the future. We had a wonderful opening from Andrew Rodman at the chair of SNOMED, and has a fantastic background in our health, our future health, which is a large prospective study in the UK. And also Andrew has a long-standing background in industry about the importance of data sets being able to be integrated and used in a longitudinal fashion to provide us insights, and therefore the common languages that needs to be used and the interoperability of the dictionaries on the background that would support the proper analysis of data. I thought that was, from a technical standpoint, was very, very important. And also then, obviously, if we build that common language, how that can inform and improve AI, because we all know that it's the quality of data that's actually going to improve any algorithms that we might develop, and therefore we need to look at the quality of data that actually go into these algorithms. And then coming back around, I think towards the end of the day, I think we were summarising over dinner what was the take-homes of the day, and I think that this is an exciting journey. There's a lot of work for us to do, but that work gives us excellent challenge, and I think perhaps for me the most sort of important bit of it is that It's the people side of things that really will make this happen. How we work and collaborate together as people, as citizens, and bring stakeholders together and take people on the journey with us. There's a significant amount of interaction and learning opportunity for us all to work together. So with that, I'll say thank you very much. I hope I captured the day, and I'll hand back over to Rhidian to look at the future of day 2.
Thank you, Matthew. And Matthew leads the Intelligence, Information and Research Division within our organisation, and you can see he was paying attention, as summarised the activity of yesterday very well. So I'm just going to give you a little 2-minute story about Lavernock Point, which is just round the corner. I don't know if you know why Lavernock Point is significant, but it is in 1897, Marconi sent the first wireless message across water. And why did he do it across water? Well, he did it across water because no one believed there weren't hidden wires. And this is about trust. So the technology was introduced, the public was skeptical, the engineers were convinced, and they needed a methodology to demonstrate that it worked and that it could be trusted. So today, the future-facing and dialogue discussion is about AI, a new technology, the data, the methodology, and trust. Do we trust it? And I think we're going to have some exciting discussions about what can we trust at the moment, and what guardrails might we have to put in as a global community to ensure that that trust is maintained. So understanding, evidence, and the translation to delivery of improved care is what we as a community are trying to do, to use data to add value to the citizens that we serve. So some exciting sessions ahead today for dialogue. Learning from and learning with others is always an opportunity to grasp. I hope you enjoy the day.
Thank you so much, Matt and Rhidian, for this.
Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare. Better diagnoses and treatments. Making healthcare smarter, one innovation at a time.